We have the privilege, again, sitting on our show, Meet the Candidates, to sit down with another fantastic candidate running for the 4th District election coming up here in September. Natalia Linos, thank you so much for joining us.
Thank you so much for having me today, Brett. It's such an honor.
You have a wide range of experience coming into this election. I think one of the more impressive backgrounds that I've read of somebody. I read it first when you came in that you were an epidemiologist and that you were running essentially because of the COVID-19 pandemic hit. And I think for me that immediately triggered like, oh, she's like just a doctor coming in for COVID and that's all that's going on. But you're so much more than that. And I want to make sure that other people in Medfield don't fall to the same trap that I did. You are a social epidemiologist, which breaks open this wide range of categories that you have worked in. You were the science advisor to the New York City Health Commissioner, and you were also a policy maker at the United Nations. Is that correct?
That is correct, yeah.
Those are like, I think that I would have that on the front of everything that I've ever done is just like giant lettering that I worked with the United Nations. Can you tell me about that?
Sure, of course. Yeah, I joined the United Nations really young. I took an exam, actually. There's something called like an international civil service exam in 2005. In my early 20s, and I entered, like people enter the State Department through an exam. The UN has an exam process, and if you pass, you get posted. And my first posting was to Beirut, where I was already speaking a little bit of Arabic, but I, did a lot more Arabic speaking, and I was in charge of, I was in the front office of an organization focused on economic and social development for the Middle East, gender equality, a lot of the tough issues. How do you move to a green economy in a place where there's a lot of oil? And then I stayed with the UN in different capacities, coming eventually back to New York City at headquarters. And there, for a few years, I was the speechwriter and main advisor to the head of the UN Development Program. And she was the former Prime Minister of New Zealand, Helen Clark. So it was amazing to work with a strong woman leader, a politician, and be kind of her person. And then the last job I had at the UN was leading the climate change and health portfolio, because climate change and the climate emergency is the top crisis that our world has been facing, and it's an existential crisis. But I've done a lot of work on global health, on poverty alleviation, on economic equality, and on gender equality. So yes, I'm glad that you now know that I'm not someone who came out of a university and I've been sitting behind a desk my whole career. I've been out in the field. I've been doing policy making. I've been doing politics in the broader sense, advising governments. And I am excited to serve District 4 at a time of a crisis, because that's what we're facing right now.
Now, it was something you did come into this race a little bit later. You were one of the later entries into the race. What was one of the things that encouraged you to jump in? And also, now that I know a little bit about your background, was the fact that you worked with like a strong woman political leader, was that something that came into your head? Like, I could also do this?
Well, I've been talking to Helen Clark and also Rebecca Greenspan, who is the vice president of Costa Rica and now leads the Ibero-American Association. She's still a phenomenal leader. I had been talking to them about 10 years ago about elected politics, just as role models. I was in my early 20s, working directly with these phenomenal women. And they always said, there's never the right time, but if you have that desire to communicate with people, it's the most direct way to make a difference. And so it's always been in the back of my mind as something that maybe one day there will be a right time, but I didn't think it would come this soon. Brett, I have 3-year-old twins, and if anybody on the show is listening to me and they know what it's like to have a 3-year-old, let alone 2 3-year-olds, something major has to happen for you to say this is the right time. But something major did happen. COVID-19 hit. It hit in such a disastrous way, and our federal government has failed us so badly that it felt that my unique experience, both as an epidemiologist, but also as someone who really understands the global dynamics and what it will take in terms of solidarity, that this is the moment for me to step in as a leader. So I did, between me and you, I did text Helen Clark and I said, hey, things are looking really bad here. I'm thinking of running for office. And she said, do it. She said, you have to do it. Elected politics can be difficult on the family, and it will be difficult on your family, but you have such a unique skill set and your country needs you. And do it. So it was definitely, I got a lot of the support from women leaders to step into this race, even though it was very last minute.
Oh, that's fantastic. Now, you have obviously, I think we can talk about this pretty openly, is you have probably the most extensive plan for COVID-19. Obviously, it was one of the main reasons why you came out and ran. But I encourage people to check out your website, which is nataliaforcongress.com. And in that, you have your extensive plan for COVID-19. Obviously, I read a little bit of the details, but hearing it come from you is definitely where we want it. But you have basically a three-part plan: the reopen, recover, and rebuild. Can you tell me a little bit about the plan and kind of go into a little bit of detail of what we're looking at?
Of course. So the reopen piece is basically, how do we reopen safely? That's top of mind for every public health leader. It talks about testing, it talks about contact tracing, it talks about how do we ask a family to quarantine and how do we provide them with the means to do so. It talks about our public health infrastructure. But we're not facing just a public health crisis. Right now, with the number of Americans who are unemployed, the businesses that have been shut down, we can't just reopen safely. We also need to recover from this deep, deep impact on our communities. So, they're three separate plans, but they're all interconnected. And the reopen piece is around staging the reopening. What I fear has happened in Washington and why we're paying the price right now is that early on, the administration was worried about the economic impact. So they tried to hide the data. They tried to say, no, we're fine. We have it under control, and didn't do enough to ensure that we had a robust public health response. And then we had this false dichotomy of it's either human lives or the economy. We know now that without ensuring the public health response is solid, we can't reopen. And so many states have reopened too soon and now are closing again. Even here in Massachusetts, we've done really well, but a lot of public health leaders are saying that we may not have done the right thing. And I was part of those calling for slowing it down and prioritizing. And so my plan talks about how do you prioritize? So for example, in Massachusetts, we've allowed restaurants to open for indoor dining, but that's not a necessity. What is a necessity is childcare, because parents like me cannot go to our essential jobs. I mean, luckily I work from home, but for a lot of essential workers, without having that guaranteed. And I worry, Brett, that if we don't reopen childcare centers, if we don't have a solid plan for school reopening, we're not only going to disadvantage kids in terms of their learning, but also working moms and working dads too. But I know that the impact disproportionately falls on women. And what will that mean if for 2 years kids are at home and moms have to pull out of the workforce or work part-time? That really sets us on a path. So the reopen part is saying, let's be smart. Let's keep bars closed so we can open schools. Let's think about unemployment insurance, ensuring that we are extending that benefit so that families are not going hungry, so that you don't have people having to choose between, a paycheck or going to work sick. Like, we really need to ensure that families have the money they need. And then the last part is rebuild. This tragedy is, it's hard to describe. We have lost over 155,000 Americans. Every day we're losing more than 1,000. We're going to hit 200,000 within months. And what can we say for this other than find some hope that we as a society have agreed that we will build back better, that normal didn't work for too many Americans. And so the rebuild part of my plan is so important. We have an opportunity right now to call for Medicare for all. We have an opportunity to rebuild our country in line with the Green New Deal. And I want to be at that table, because the next 2 years, the next Congress will be deciding on the vaccine rollout. They'll be deciding how to put people back to work. And I have the experience both to help people get back to work safely, but also to put us on a path that works for everyone. And that's my commitment to everyone listening tonight.
Absolutely. And your experience that you talk about is not just the experience here in the community, but also that global experience that you have, seeing the world in the way that you have seen it. I love that you have the Green New Deal aligned with the COVID-19 as a recovery, or I should say as the rebuild. Why is it that you felt that the Green New Deal was a part of the COVID-19, rebuilding?
So my biggest worry is that Washington and the folks making decisions are going to say, right now we need to get people back to work and we need to focus on our economy. and the environment can't wait. But as a scientist, as someone who has studied the impact of climate change on health, the impact of environmental degradation, I know that we cannot wait. We cannot wait 5 years to recover from this tragedy and then start thinking about the environment. So I'm going to be the strongest advocate, saying that as a public health expert, I know that these challenges are interconnected. And I use this term zoonotic disease, which is basically diseases like Zika, like Ebola, like COVID, that have to do with our human interactions with animals. And more with climate change, as temperatures change, we're going to have more malaria in parts of the world. We're going to have more Lyme disease in this country and in Massachusetts. We need to recognize that our environment shapes our health. And so we can't wait to deal with that. And, a lot of the climate activists are saying this is a front line, an opportunity to see what crisis actually looks like. And just because the climate crisis is quietly hitting us, we should have as a robust response as we have now, so that in 10 years down the line, we're not in crisis mode, which is what we are in right now. So I am committed to ensuring that the money that the federal government is going to have to pour into recovery, that it's poured into smart green solutions, not just poured into any solutions.
And one of the other things that's also integrated in your COVID-19 plan is actually in all three stages is the education, is, in the first reopen is vaccine awareness and lowering the cost. And, that is going to take some educating, and that's going to take, putting information out there, protecting healthcare jobs, things like that. In the recover stage, you have invest in schooling. And then even again, in the rebuild stage, you have invest in schooling and childcare. So obviously you are integrating a lot. I think that it's fair for people to say that it's more than just a COVID-19 plan. This is more than just an epidemiologic, viewpoint. This is an entire world view that you have in this one COVID-19 plan that you have.
Exactly, because I do think that we can't solve COVID-19 through just technical solutions. It's not simply about getting everybody tested and treated, because we know from how this has played out is our society, the way workers didn't have access to paid leave, the way that we didn't prioritize, PPE to everyone, the way that our systems work. Some parts of our communities, some parts of our state, some parts of our country have been hit harder. And, you didn't say it, but equity is the key lens through which I look at this. And this is why I entered this race, because it's not only that all Americans have been hit hard, but some Americans, especially Americans of color, Black Americans, Indigenous Americans, as well as the elderly, in our nursing homes, they've been hit so hard, and we have a responsibility to do something about that.
Absolutely. And you have the shared prosperity. Again, this is all from your website, the nataliaforcongress.com. A lot of great resources, great links that are on this. People can definitely go to this and see more detail that's going on. But one of the things you talk about is Natalia is committed to, one is the fighting for 15, as well as the equality in the workplace. Tell me about those. Tell me why you feel like those two are so important to highlight on your website.
So both are really important. The fighting for 15 and workers in general, I think, is fundamental. This country has, it's one of the wealthiest countries, and yet there's deep poverty. And there are workers who basically over and over again are unable with one job to meet the needs of their families. So you have people in Massachusetts who have 2 jobs, 3 jobs. They don't get to see their kids. And part of the solution is ensuring that people have a living wage. Part of the solution is closing tax loopholes, or ensuring that our tax policy is actually progressive and working for the poorest and those working class families, not just the richest. And part of it is ensuring that we have gender equity in the workplace. And, I talk about harassment and, other forms of inequities, but a big one is that there's a wage gap. For every dollar that a man makes, a woman makes $0.7 for the same work. And those inequities are bigger if you are a woman of color versus, a white woman. So it is important to talk about a living wage, and to be honest to ourselves that if someone is working 8, 10, 12 hours and has a family, they should be able to afford to have a house. And yet many workers are homeless. They should be able to have access to healthcare. And yet millions of Americans are underinsured, if not uninsured. And the number one reason why people file for bankruptcy is because of bills from health care. I mean, we are broken in some fundamental ways. We need to ensure that our families, our communities are able to work and have a life and a future for their kids, not work, 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 and still be in dire conditions.
Absolutely, and it's an important note as well. I think a lot of the times when people talk about the $15 wage, they talk about how those are the low, the low bar jobs. You're not supposed to be in that career forever. You're not supposed to be doing that to raise a family. That's, you're doing that at, being a bagger at Stop and Shop isn't as important. But when COVID-19 hit, those were the essential jobs. Those are the ones that kept our communities together. Those are the jobs that ended up keeping our society as a whole together. And that's what actually, I think, if anything, COVID-19 really highlighted was that those jobs were some of the most important to our society.
Yeah, exactly. You're absolutely right. And then, you can make that analogy to teachers, right? Every parent, because of COVID, now recognizes how difficult that job is, how difficult it is, and how we have underpaid teachers, how we have not invested. I mean, more so childcare workers. They get so little money, and yet it is such hard work and it's such an investment. So we do need to have a conversation about our values as a society, where we put our budgets, and our budget should be going to the things that matter most. And what matters most is our people. It's not our big corporations. And that's my promise, that I will be bringing science and data and an equity lens to every question.
Absolutely. Now, to talk about the equity, you have paid sick leave as well, and reforming unemployment insurance. These are all things that are out there for you. Where did you come up with these different concepts, these different things that really highlight your policies going forward?
Well, a lot of the lessons and a lot of the policies that I have come from my experience, both growing up overseas, but also working overseas. I haven't shared this yet on this show, but my parents were international students. So I was born in the US, but they moved back to Greece when I was a baby. So I spent my first 17 years in Greece, in a country where there is a system of universal health coverage. There is a national system, a country where universities are free. And I saw my parents. My mom was the daughter of a baker in her small village. My dad was the son of a refugee, and they're both doctors, successful doctors right now. So they lived the American dream in Greece because they had these opportunities of free education, and they were able to even come to the US for their after medical school. They came here to do their training, despite the fact that their family came from very simple means. Obviously they had something, but because a baker in a village is an important job to have, but they were working class families. And it's so ironic that that opportunity to live the American dream is not possible here in our country today. And so the issues that I have highlighted in my plan on shared prosperity is around those issues. So unemployment is top of my plan right now because of the COVID impact. But I've been speaking to economists, and they have said our unemployment insurance has been a disaster since the beginning. Every state can do what they want, and some states only provide 30% coverage, some provide 50%, and the number of weeks is 26 weeks. We need a national uninsurance, a federal plan, one where you have a whole year, where you have at least 50% of your income. And, we know that that isn't going to disincentivize people from finding work, but we need that because, especially at a time like this with COVID, people are going to be uninsured for a long time.
I think this is one of the things that, you came out to run for this because of COVID-19. I think people are starting to realize that, hey, our systems were not built for these types of scenarios. And on an individual level, you can talk to people who have lost their job from COVID-19, and that the federal government's system is not helping them in the sense that they need to be able to survive. So I absolutely think that this is it goes right along with you running for this position, is right along with all of your policies that you're coming out with. So it makes total sense. Absolutely. One of the things is the healthy planet as well that you have out here. transportation policy that works for people in the environment, the transition to renewable energy and putting a price on carbon. These are the different things that you have going forward for the Green New Deal, for things like that. What were some of the things specific things that you would like to see us do to help the environment and to help a healthy planet?
So I think public transportation is one very obvious way, especially because 40% of emissions in Massachusetts are due to the transportation industry. You know, I'm lucky enough to live in Brookline and not own a car. We can get around with buses, and my family can walk to, you know, my daughter goes to the public school in our neighborhood, so she can walk to school. We can walk the kids, the twins, to daycare. You know, we can use the Green Line when we need to use the Green Line. And that's a privilege. And I recognize that as a privilege, and that should be available to everyone. That's because public transportation is important, not just for our environment. It's also important for our health because, you know, you have healthier air quality if you don't have a million cars stuck in traffic outside your home, you know, with exhaust pipes. You also can get to work in a reasonable way without having to be stuck for 2 hours in traffic. And I've been talking to people across the district, but especially in the southern part, who are saying, you know, we need the South Coast Rail. We need to invest more in our rapid bus system. We need to ensure that families who don't own a car here in Fall River are able to have that, you know, job opportunities and the lifestyle that you can in Brookline. And I hear them, and I will deeply, deeply commit to investing in public transportation because it's a triple win. It's a win for health, it's a win for the environment, it's a win for our workers. That's one part. The other one is renewable energy. You know, as someone who was part of the UN during, you know, the Paris Agreement negotiations, have supported governments to think through how we achieve, you know, a future that is that fights climate change without doing something on renewable energy and fighting fossil fuels, we're all in trouble. So that's another big part. And the last thing I want to add, which is on my website, is I really believe in the sort of young people and that movement that they have created. I honestly am so excited by young people across the globe, including in Massachusetts, you know, Sunrise Movement, but also other organizations who are saying, you know, we need you adults to pay attention because you're leaving a planet to us. And I love that their message is also one of equity, where they say this has to be done paying attention to racial justice, to, you know, communities that are impacted by environmental, you know, injustice, where toxic pollution is, you know, basically in communities that are poorer. And they say, you know, think about a just transition. So I've really enjoyed talking to young people, and my campaign has around 200 volunteers. The majority are young people committed to this vision of a future that will work for them and a present that is equitable.
What is that like to have 200 people want to volunteer their time to back you? That is, I mean, if I looked back and had 200 people standing behind me, that'd be quite a moment for myself. What's that like for you?
Brett, that has been the highlight of this run. You know, people say, what is the thing you dislike the most and what is the highlight? That is certainly the highlight. The energy, you know, I have events with different universities several times a week. So I had, you know, BU and Brandeis, and, you know, students are excited for a progressive voice, and they're excited for science. They're saying we need more scientists in Congress, and they are stepping up in ways that I don't know if I would have in my early 20s, you know, really committing hours on text banking and calling. And we have, you know, a Slack group where they'll ask me questions, and be like, what is your belief on this? You know, someone is asking on the phone, and it's wonderful. It's so wonderful to see their energy, their commitment, and their drive. And, you know, there's on Twitter, and I know Twitter is like a subset, there are a lot of students who are saying, oh, I don't know who to vote for. And I've really enjoyed sort of saying, give me a call. And, you know, I've been speaking to students, and my team sort of laughs. They said, you know, you just spent an hour speaking to this one student. And I was like, but they are who we are serving. They are the future. They are part of what's going to push us, and they have great ideas. And so that hour is completely worthwhile. And let me tell you what I don't like. What I don't like, Brett, is that politics is all about money. It is all about money and how much you've raised, and that signals that you're viable or not viable. Whereas the energy, that is what should signal whether you're viable. And it shouldn't be about, do you have $1 million to put out a big TV ad? Because I'm not a product. I don't need someone to advertise me in 10 seconds. I am someone with big ideas, a plan, and a leadership style that is unique, that, you know, but that's the frustrating part.
One of the things is you can look at if someone can have a 10-second, commercial that says everything about them, maybe there should be more substance. You certainly cannot take in your COVID-19 plan in 10 seconds. There's a
No.
lot of substance there and a lot of effort. But the energy thing that you're talking about is so important. I talk about this with all the candidates. I don't know how any of you find the energy to go through these races. They're incredibly, I mean, you guys last week, all the candidates went through a debate. Then you went through this week. I know that you probably had something that was prior to this. Then it was my interview, and now you have another interview. I think tonight.
And then another debate tonight is the racial justice debate. Yeah.
Yeah,
It
there's
goes.
so much going on.
Yeah. I think to some extent, extroverts do better in politics, and that's something I have learned. I have these Zoom calls, with groups of people, and I get energized. My team, I'll go in being like, I'm exhausted, I haven't slept. And then after 3 hours of conversations, I feel excited and energized. And somebody said to me, like, that's great, because that is what politics is about. It's about talking to people, and you love it. You love having the one-on-one conversations. You love having the group conversations. And I've started something called Ask Me Anything. So every day at noon, I'm on Zoom, and on my website, it has the link every day at noon, and anybody can show up. And it's been wonderful. I have people from, retirement homes, workers from Taunton, and nurses who basically are like, I'm having my lunch break. So I did it from 12 to 12:30 so that people could use their lunch break. And it's been great. Sometimes it's 3 or 4 people who show up and they ask me the specific issue that they care about deeply. It might be somebody had, their top priority was policies in Latin America. And, I had to be like, I'm not an expert, but let's talk it through and let me hear what your policies are. So it's been wonderful running. But yes, it is exhausting. And yes, I miss my family, because a lot of these Zooms, the kids can't be here with me.
Yeah, absolutely. And I apologize for taking your family away from you. And I'm sure I speak for everyone else. It's not our intention, but it is one of those things that is most taxing. I think people don't realize that candidates are going through a really difficult time when they run for these races. I mean, the other thing is the amount of energy it takes to be under a microscope. I don't think I've ever felt worse for, science class back in high school with all the microscopes. It's so much energy going under a microscope. It must be really difficult for you guys. So I feel really bad about that.
It is, but it's also, like you're doing a service. You're, especially at a time of COVID, like us being able to be on television or be on radio or be on Zoom calls allows people to get to know what we stand for. So I'm grateful that you're doing this.
Absolutely. Now, your priorities page, you have, like we've already looked at, the healthy communities, the shared prosperity, the healthy planet, and then below that, I just want people to know, we don't have to go through all of these, but you have on almost every single thing that you could possibly talk about, you have information, you have resources, you have your policies and your stances on them. Definitely a great resource. Can you tell me about putting this together, the effort behind that, and some of the things that you really stood behind on getting this website together with all the resources you have available?
Yeah, I think it's important for people who are going to vote to know where I stand. And there are too many issues to make them my top priorities. So my top priorities are the 3 we talked about, but I have strong opinions around LGBT rights. I have strong opinions around criminal legal reform. And I wanted people to know that I have thought about it, that I have engaged with both the evidence, because I'm running on a platform for science, and I have ideas on how to move forward. In many ways, like there are things that are missing, and some people have come to me and said, what is your specific policy on nuclear weapons? And that is probably missing from my website, and I'm happy to have those conversations in the Ask Me Anything. But I know the key issues that voters care about. I want them to be able to see where I stand on those. So I have a team, that is made up of a lot of volunteers, but a lot of these volunteers are experts in these areas. I have a top, scholars on education policy that helped me write that piece. I have top scholars that have looked at the criminal legal system and have studied for decades, the inequities and the racial bias that goes into both policing, but also mass incarceration. And it's through conversations with them, with others who know the fields, that I have developed these policies, which is, this is what I stand for and this is what I will fight for. But, there's been a lot of learning during this campaign, but luckily, because I've had such a broad career at the UN, especially, touching on a lot of the issues, I had a foundational understanding of pretty much everything that's on my website. I wouldn't put anything that I'm not super comfortable to be, for example, you asking me an interview on. But the details are developed in teams with smart people, and that's how I will represent everyone in, if I am in Congress, I will also loop in those smart people to help me think through those plans. It's important for people to recognize that it is important to know what you know and what you don't know, and to bring in the right people to advise you on what you don't know.
I don't want to take up too much more of your time. I do want to say I put a lot of emphasis on the details in your entire page, but I do want to say this is that it is actually not a hard read. You have taken the verbiage, you've taken the language, and you've written it in a way that I think people can easily read and understand. And that should be noted because although very detailed, like your COVID-19 plan is something that I ingested, I could read it, I could understand it. Which definitely tells me that not only are you a highly educated and intelligent person, but also to be able to explain it to someone on my level, which I'm not going to say I'm uneducated, but I'm certainly not on that level of understanding. You certainly were capable of
I think communication is I really believe communication is critical to politics. And, I've been a speechwriter for many years, and that is the role. You translate the difficult academic science to something that anybody can understand and everybody should understand, and that is a big role. That's what I've been doing for a lot of my career. I write in op-ed pieces in the Washington Post, and I write in other journalist style, because I think that's what people want to hear. And the biggest challenge with COVID has been risk communication, basically people not knowing who to trust, who to not trust. And that is, I think, a strength that I bring. That is something that is not learned. Like, you're a good communicator by training over time, but not most scientists, I would say, are not. So I'm very pleased to have that skill to bring to the table. And thank you for noting that my writing is also clear. I appreciate that, Brett.
Absolutely. Now, only a couple more things that I want to give you the opportunity to talk about. Natalia, obviously there's a lot of great candidates, and they each have some great qualities that are about them. Medfield residents are going to be looking at these interviews. They're going to be looking at your website. What are the things that they should know? Why should they vote for you?
You are absolutely right that there are some great candidates. There are. And under normal times, I would be voting comfortably for quite a few of them. I'm excited that there are 4 women running. I think that is a historic opportunity for us to have a congresswoman. I'm excited that there are smart, committed people across all ages, and there's at least some racial diversity. There isn't a lot of diversity in terms of our hometowns. That is something that we need to work on, but that is something to be said about just finance laws around campaigns, which is at the heart of this. But we're not in normal times. In a normal race, I wouldn't be running. I entered literally 1 week before the nomination papers were due because it felt urgent. It felt urgent for me to bring my skill set, because we are in a moment of deep, deep crisis, and it's a public health crisis fundamentally. And also on top of it has been overlaid an economic crisis and a racial justice crisis. And I have worked on all those issues, both globally and at the local level in the New York City Health Department. So I have the skills to lead us through this. And as a mom of 3 kids, I know that I will prioritize families, I will prioritize our schools, and I share that fear that every parent has across the district of what is happening in September. So I have both the perspective, the lived experience of being, a mom, and also the technical skills. So it feels like I am the candidate of the moment, and hopefully from what you've heard today, I can also push for the issues that matter during normal times, our climate crisis, our economic development, our racial justice. So I hope people will be excited about having someone who's a bit of an outsider, not a bit, a lot of an outsider, someone who didn't, hasn't always been in the local political frame, but who believe that, right now we have 14 scientists in Congress, and we actually need a 15th because we're facing one of the biggest challenges of our generation.
Absolutely fantastic. The last thing I did want to ask you about is, as we're going through this, not only just the normal election cycle, but also because we're in this pandemic times and we're Zoom meeting and we're doing all this, the unique thing that has been highlighted for me has been the access stations and what we're actually capable of doing. You've worked now with a few different access stations, whether it was Milford TV a little while ago. You're now in an interview with Medfield TV. I'm sure you've talked to a couple other of us.
Yeah.
What's been your experience with access TV, and what do you think of going, if you were elected, how you would interact using access stations going forward?
Yeah, this is great. I mean, it's great to be able to reach, especially for someone like me who likely doesn't have, 500,000 to do big TV ads. This is the way to connect. This is the way to interact. And I've enjoyed the questions. I've enjoyed the journalists. You seem so well prepared. It's been really wonderful. And I do think that an important, a critical role of the representatives to actually represent and actually listen. And I think the different ways of engaging with, your constituencies would involve, of course, writing and calls and face-to-face meetings. But Access TV is a good way. And I've said that around a number of issues. With COVID, we have innovated, we have had to adapt, and a lot of the lessons learned can be put into place for the future. And so I welcome this opportunity to be more, a more core part of how candidates interact. So thank you for doing this.
Absolutely. Thank you so much. Medfield residents now have yet another hard decision to make. They have another great candidate that they can hear from in Natalia. Thank you so much for joining us today. And truly, I hope that the Medfield residents go and at least check out your website, the nataliaforcongress.com. Look at everything that you have out there, because there was obviously a lot of effort put into that website, a lot of information that's out there. And really, truly, thank you so much for coming on with us today.
Thank you. Thank you.